Assalamu alaikum. We are here to present our topic Smart Healthcare. Our group members are Wasil, Anas, Abdul Rahman, Fahad, Zunaira, Laiba, and I am Uzefa Zakir. Healthcare is one of the most important parts of our lives. Traditionally, patients had to visit hospital for almost every medical checkup. Doctors also depended mainly on paper records and manually collected information. However, technology has completely changed this process. Today, smart devices, mobile application, artificial intelligence, and online consultations systems are helping doctors provide faster and more accurate healthcare services. In this video, we will discuss what smart healthcare is, the technologies behind its application, benefits, challenges, and its future. First, Vasil will explain the basic concept of smart healthcare.
Assalamu alaikum. Thank you, Zafa. Smart healthcare means using modern technology to improve medical services and patient care. Its main purpose is to make healthcare more accurate, accessible, efficient, and personalized. For example, a smartwatch can monitor a person's heart rate and physical activity. A mobile application can remind a patient to take medicine, while an online consultation platform can connect a patient with a doctor without requiring a hospital visit. Smart healthcare is different from traditional healthcare because it uses real time information. Instead of waiting for a patient's condition to become serious, smart systems can identify warning signs at an earlier stage. We can understand smart healthcare through three important activities. First one is monitoring, in which smart devices continuously collect health information. Second is analysis, in which software examines the collected information and identifies unusual patterns. Third is response, in which the system alerts the patient, doctor, or hospital when medical attention is required. Therefore, smart healthcare does not mean replacing doctors with machines. It means giving doctors better information and tools so they can make more informed decisions. Now, discuss the major technologies used in smart healthcare.
Thank you, Vasil. Thank you, Vasil. Several technologies work together to create a smart healthcare system. The first technology is Internet of Things, commonly called IoT. It connects physical devices to the internet so they can collect and share information. Example include smartwatches, glucometers, blood pressure devices, and smart hospital beds. The second technology is artificial intelligence or AI. AI systems can examine large amount of medical information and identify patterns that may be difficult to detect manually. For example, AI can assist doctors in examining x rays, scans, and laboratory reports. The third technology is cloud computing. Cloud computing system allow hospital to store medical informations electronically and access it from different authorized locations. Another important technology is big data analytics. Hospital generates large quantity of information about patients' diseases, treatment, and medicines. Data analytics help healthcare professionals use this information to understand these patterns and improve services. Finally, mobile health application allow people to book appointment, receive medicines, reminders, view reports, and communicate with doctor through their smartphones. These technologies make healthcare more connected and intelligent. Abdul Rahman will now explain some important applications of smart healthcare.
Assalamu alaikum, everyone. I hope Anas' presentation gave you a clear understanding of the previous topic. Building on that, I'll now be presenting a smart healthcare system in real-world application. So one of the major application is remote patient monitoring. Patient can use devices at home to measure their heart rate, blood pressure, blood sugar level, or oxygen level. This information can be shared with a doctor who can monitor the patient without requiring frequent hospital visits. Another application in my topic is telemedicines. Through video or audio calls, patient can directly consult doctors from their homes. This is especially helpful for people living in remote areas, elderly patients who have aged peoples and individuals who cannot travel easily. Smart healthcare, I think, is also used in electronic health records. Instead of keeping information only on paper, hospital can maintain digital records containing a patient's medical history. It is helpful in this regards, I hope. Medicines, allergies, test result, and previous treatment are also useful for this topic. Another interesting application is robot assisted surgery. This is a very advanced topic. In some hospital, doctors use robotic systems to perform complex procedure with greater control and precision. However, this system will operate under the supervision of trained medical professionals because this is very critical application. So this will be done under some trained professionals, I guess. Smart medicine boxes can also remind patients when it times to take medicine. Some system, I think, can even notify a family member. I guess if a dose is missed. These application I discussed in my part is shows how technology works, how technology can support both healthcare workers and patients. Now I would like to call Fahad, and Fahad will now explain the main benefits of this particular topic. Thank you.
Thank you, Abdurrahman. Now I'll discuss my topic. Smart healthcare offers several important benefits. These benefit is early detection of disease. When smart devices continuously monitors a patient's condition, they can identify unusual changes before the problem becomes serious. The second benefit is faster medical assistance. For example, if a wearable device detects a dangerously abnormal heart rate, it instantly sends an alert to the patient, family, or healthcare provider. The third benefit is better access to healthcare. People living far from hospitals can receive medical advice through telemedicine. A real life example of this exists right here in Pakistan, Supargo, in collaboration with Inotech, developed Sky Clinic, a satellite powered telemedicine terminal supported by the ParkSat MM1 satellite. It brings diagnostic tools, vital signs monitoring, and real time doctor consultation to remote and hard to reach areas of the country. Another benefit is personalized treatment. Another benefit is personalized treatment. Every patient has a different medical history, so by analyzing individual health information, doctors can select the most suitable treatment for each patient. Smart healthcare also reduces the workload of hospital staff. Appointment scheduling, report management, and medicines reminder can also be automated. Finally, digital records improve coordination among doctors, laboratories, pharmacies, and hospitals, ensuring accurate information is available at the right time and leading to better decisions. Despite these advantages, smart healthcare also has some limitations. Sunera will now explain all these challenges.
Assalamu alaikum. I am Zanera and I will discuss about challenges and ethical concerns. Thank you, Fahad. Although smart healthcare is useful, it also creates several challenges. The first major concern is privacy. Medical records contain highly sensitive information. If this data is accessed by an unauthorized person, it can seriously affect the patient. The second challenge is cybersecurity. Connected medical devices and hospital systems can become targets of cyber attacks. Therefore, hospitals must use encryption, strong passwords, access controls, and regular security updates. Another challenge is the cost of implementation. Advanced devices, software, staff training, and system maintenance can be expensive, particularly for small hospitals and developing countries. There is also the problem of technical failure. A device may provide an incorrect reading because of a damaged sensor, weak internet connection, or software error. This is why doctors should not depend blindly on technology. AI systems can also produce biased or inaccurate results if they are trained using incomplete or unbalanced information. Healthcare professionals must review AI generated recommendations before making final decisions. Finally, not everyone has access to smartphones, reliable internet, or digital knowledge. This is known as the digital divide. Therefore, the smart healthcare should implement responsibly with patient safety, privacy, affordability, and human supervision as its main priority. Now, Laiba will explain a practical example and the future of smart healthcare.
Thank you for handing over me. So now I would like to discuss about real world examples. So the most common real world example is, let's discuss. Suppose a patient has a heart condition and wears a smartwatch connected to a healthcare application. The watch continuously measures the patient's heart rate. So one day the device detects an unusual pattern. So it sends that information to the mobile application, which immediately alerts the patient. With the patient's permission, the information is also shared with the doctor. Then the doctor examines the data and arrange the online consultation. If the condition appears serious, the doctor advises the patient to visit the hospital immediately. In this example, the smartwatch does not replace the doctor at all, but it provides an early warning while the doctor interprets the information and decides the correct treatment. In the future, the smart healthcare may become even more advanced. AI could help identify the diseases earlier and could monitor the more health indicators, and virtually reality could be used for medical education. A smart hospital may use connected beds, automated medicine system, and intelligent emergency management. However, the human role will remain essential because the patients also require empathy, communication, trust, and the professional judgment. So now I would like to call Uzafa to conclude the topic.
Thank you, Laiba, and thank you, everyone. To conclude, smart healthcare is in the integration of healthcare with technologies such as artificial intelligence, IoT devices, cloud computing, data analytics, and mobile applications. It can support early disease detection, remote monitoring, online consultation, digital media medical records, and personalized treatment. It can also save time and make healthcare available to people living in distant areas. At the same time, issues such as privacy, cybersecurity, high cost, inaccurate results, and unequal access must be handled carefully. Our main conclusion is that technology should assist medical professionals, not completely replace them. The best healthcare system will combine the speed and analytical capabilities of technology with the knowledge, experience, and empathy of human doctors. We hope our presentation helped you understand the concept and importance of smart healthcare system. Thank you.